As COVID cases rise, some members of Chicago's COVID-19 Community Response Corps say they're prepared to handle the winter months. Earlier in the pandemic, the program began by focusing on contact tracing, but it has since expanded to meet other needs like scheduling vaccine appointments and working with the city's COVID hotline. The Chicago Cook Workforce Partnership is leading that effort. It's working with 31 community-based organizations in some of the city's hardest hit areas, and it's hired more than 600 residents to work within their communities. Joining us now are three members of that corps. Cynthia Rodriguez, COVID-19 Response Project Coordinator for the Chicago Cook Workforce Partnership. She lives in Belmont-Cragen. Cornelius Chandler, also a COVID-19 Response Corps member hired by Breakthrough Ministries in West Garfield Park. And Jasmine Love, a COVID-19 Community Response Corps member. She works for the Safer Foundation in Inglewood, a community-based organization that is part of the Corps. Welcome all three of you to Chicago Tonight, and thanks for joining us. Cynthia, let's start with you, please. Briefly share a little bit about what the Corps is and how it's expanded its work throughout the pandemic.
Yeah, so thank you for the opportunity. The Corps consists of 30 community-based organizations that are located all throughout the city of Chicago, targeting the hardest hit communities. So all of the Corps members are residents of these neighborhoods in the city of Chicago. And of course, it's service within the community for communities. We are from the hardest hit zip codes, in the city of Chicago. So we know the needs of our communities health-wise and for resources.
Cornelius, you now work at the COVID hotline for the Corps, but before that, you did contact tracing. What did you hear from some of the people when you'd call them? Fears, I imagine, about the virus?
Yeah, absolutely. People are always kind of concerned for themselves and their families. You know, you get those tough calls where people just don't know what to do or how to handle this situation the way they need to handle it. And, you always kind of lead with love, and you always, kind of be sympathetic towards their situation. And I'm putting myself in a position to kind of help them. It feels great when I'm able to supply resources and to be able to kind of calm them down and make sure that they safe and their families safe.
Jasmine, are there any, phone calls or any residents that you've spoken with that, that really stands out in your memory? I think there was one person who called back looking for you.
Yeah, so I get a lot of different type of calls, and I just encourage the people to get vaccinated and get their boosters. But I had one client that did not want to get it, and I guess I persuaded him to get it, and he called back asking for me. So I was so happy when he did that.
Yeah, and when he did that, was he calling to tell you that he had already changed his mind,
so
or that he had done it?
He called the hotline and he asked for me, and he said, "Do you remember me? I didn't want to get it, and now I'm ready." And I set him up an appointment to get his vaccination.
All right. Now, the initiative works with community-based organizations in some of Chicago's hardest hit communities, as you've said. Here's a clip from KARIN Norrington-REAVES. She's CEO of Chicago Cook Workforce Partnership. That's the organization spearheading this effort with the city.
It is incredibly important that we have people who are of the community, by the community, and for the community, speaking to members of the community. And so I cannot underscore enough how important a role we have played in terms of ensuring that folks who are addressing the needs here understand the stories of the people who are in need.
And Cynthia, what impact have you seen this have on community members?
I think just seeing the need for resources and support within my community, I think it became a norm for all, city residents to see an ambulance come down your block every other day. And I think seeing how scared people were and the lack of resources that were needed, and also in the language and from people that, look like you and sound like you, I think was really important for us to, have that effect in our communities and be able to provide them with so much support and resources.
Cornelius, would you say this has been an effective way to help people in your community as well?
Absolutely, absolutely. Whenever you can get the message that's not so scripted, and it's coming from somebody that's just like you, that live in a neighborhood, that kind of live the same life that you live. And Chicago, the partnership has did a great job kind of educating us, but also allowing us to be ourselves. And whenever you're able to be yourself and you're talking to another person, it opens them up to kind of be themselves. Now, whether the message is anti-vax or pro-vax, being able to be an active listener for the community members, it builds a level of trust. And that's what it's really about, the trust between the information that we're giving them, and because we really want to help them in their families.
Now, the work, I imagine, it also involves talking with people who have COVID. Maybe they've had family members who've recently been lost to COVID. Jasmine, how does this kind of work affect your own emotional health?
So it can get a little bit overwhelming and emotional at the same time, but we have a great support system. So Cynthia will chime in, and Cornelius, and we'll just take a break and talk to each other to overcome it. But it can be very emotional at times.
Cornelius, what about you? How's the work itself impacted you?
Yeah, absolutely. It's emotional when you're talking to a senior citizen that don't have anybody, don't have any family, and they just want to talk to you. It's emotionally impactful. But I always remember why, I took the job. And it's for situations like this. At times I'm empathetic. I could be sympathetic towards these type of situations, and I remember. Again, I'm gonna say this again, I always lead with love, right? So man, because I lead with love, it kind of don't impact me as much as it some would say should, but I know the love in my heart guides me through that situation.
And you're able to manage it.
Absolutely.
So the Corps also works with the COVID hotline, as we mentioned. Here's another clip from the CEO of the partnership again.
We are not providing simply a response to COVID. We're not doing simply the contact tracing. The single greatest call for services that we receive as we're staffing the resource center, the single greatest call we receive is for food assistance. So there's a tremendous food insecurity. There's also health insecurity. And we want to connect people to all of the different resources and services that are available.
And quickly, Cornelius, you work the COVID hotline. What do you hear from the people who call in about their needs? We just heard from KARIN NORINGTON-REAVES there saying food assistance is the greatest request.
Yeah, absolutely. And we just started a resource navigation program that's directly from the call center. So I hear people that need not only food assistance, utility assistance, rent assistance, people that's calling in, homeless people calling in to get shelter for the night. So it embodies whatever type of resources that the citizens of Chicago need. So yeah, it's
not just assistance with finding a vaccine or a test or anything. And of course, as more communities detect the Omicron variant and as COVID cases rise, people are gathering for the holidays. Cynthia, do you expect your workload to increase going forward?
We definitely do expect it to increase, but I can speak on behalf of the whole Corps. We're ready. We're ready for that next challenge. We're ready for that next calling. So we're all, getting additional training, getting educated on how to educate our community and our residents in the city of Chicago. So we do expect a surge, but again, I think the Corps leads with love. We lead from the heart, and we're just here to continue serving our Chicago residents.
Okay, thanks for the work that the three of you do. Jasmine Love, Cornelius Chandler, and Cynthia Rodriguez.
Thank you.
Thank you.
Thank you.